desperation for Stafford. 8 seconds left. Loading up near side Nakua. Is he out of bounds?
Oh my God.
With 3 seconds.
He's
They're going to run the clock. That's going to do it. The Seahawks soar to Super Bowl 60.
The Seattle Seahawks are playing in the Super Bowl this week, bringing hope to the Northwest that they can bring home another championship. But one former NFL player is making it his mission to spread hope to those who have been diagnosed with lung cancer after losing his wife to the disease back in 2012. Former NFL linebacker Chris Draft is not only making it his mission to educate the public about lung cancer, that 60% of those diagnosed are not smokers, he's also spreading the word that there is hope for those diagnosed with this disease. Chris, we'll start with you. Tell me about your foundation. Tell me about the Draft Family Foundation, what you guys do.
So first, I want to thank Johnson & Johnson for having us here and setting up this interview. But I want to speak directly more to the lung cancer aspect. And so that would be Team Draft, that was founded between me and my wife, Keisha, on our wedding day. It was founded because my wife was diagnosed with lung cancer in December of 2010. 37 years old, amazing shape, challenging me to do P90X and run a 10K race, and out of nowhere had a little shortness of breath. She knew her body, so she called her primary care doc, set up an appointment, went in, and chest x-ray came back mass in the left lung. 2 days after Christmas of 2010, we confirmed to a biopsy lung cancer, right? And then we found out the most important fact about lung cancer, that anyone can get it. A couple weeks later, we found out through a PET scan that she had stage 4 lung cancer. And January 2011, there was hope. There was opportunity through biomarker testing that there were some new treatments. Unfortunately, her biomarker testing came back and that she was negative for those treatments. And so she ended up on standard chemo and radiation, and she passed.
What is the most important thing you want people to know?
Well, most important, anyone can get it and nobody deserves it. So everyone matters. And that there's hope. There's hope. And that hope, as it relates to treatment that Jeannie's going to talk about, is through biomarker testing. With biomarker testing, we find out what's driving your cancer so that you can be on the most appropriate therapy. And so, again, people are living longer and living better quality of life. And it's something that we have to tell people, because otherwise, if you hear cancer, you're like, oh my goodness, it's over. Unless we tell people, unless we educate people. So thank you for having us on so we can let people know that there's hope.
Jeannie, now you are you're dealing with lung cancer. Tell me about your symptoms and what led to your diagnosis. This is kind of a two-part question, and how you and your doctor decided on a treatment plan.
Yeah, I had a slight cough, so I went to my doctor, and she told me it was probably just allergies and that the cough would go away. And after a few weeks, the cough did go away and I was fine. But in early December, one day I got up and I had to go back to bed. I was just exhausted after my shower. I was diagnosed with pneumonia and treated for that, but since it really wasn't pneumonia, I wasn't getting any better. And I ended up going to the emergency room on the advice of my daughter's friend, who is a doctor. It was then that I found out that I had stage 4 cancer. And the oncologist that came in and told me about it said that they would do their best to keep me as comfortable as possible. And now I'm on Rybrevant and Lazcluze. Rybrevant is an infusion therapy, a targeted therapy for my type of cancer. And the Lazcluze is a daily pill that complements it to kind of give it a 1-2 punch. And although I have had side effects, I report my side effect to my doctor, and together with his team, we treat that side effect. So I have not had serious side effects from the drug. And after only 6 months, my cancer is almost gone, and I'm getting my health back.